There is a fifth dimension which is now known to man. It is a dimension as vast as space and as timeless as infinity, but which can be continuously counted. It is the middle ground between anxiety and relief, between science and superstition, and it lies between the pit of man's fears and the summit of his knowledge. This is the dimension of imagination. It is an area which we call the obsessive-compulsive zone.
Oh, hi, hello. Oh, that wasn't right, cut. Oh, hi there. Howdy. That wasn't friendly enough. Let me start over. Oh, hi, hey there and hello. Yes, nailed it.
Allie, you gotta keep doing the intro.
Oh, right. Cut. Hi, hey there and hello. I'm Allie Brett, and I'm here to talk to you today about obsessive-compulsive disorder, also known as OCD. Having been diagnosed with said disorder, I'm a bit of an expert on it. Today we'll be talking about some of the more common obsessions and compulsions, and then we'll dive into my own case, or rather, cases. Hello, Dr. Cornwall. Hey, Dr. Cornwall. Yo, what's up?
Nice to see you again, Allie.
So, Dr. Cornwall, as you know, we're discussing obsessive-compulsive disorder, also known as OCD. Would you mind answering a few questions for us?
Well, you're already in my office. Go ahead.
It's quiz time! Question 1. What are the 3 Ds Dr. Rosenthal would say constitute diagnosing a disorder, and so have to be in place to diagnose obsessive-compulsive disorder, also known as OCD?
Well, behaviors have to interfere with the patient's life. The patient needs to be upset about it, and the behaviors need to stand out from normal interactions.
Oh, I'm sorry. We were looking for simply dysfunction, distress, and deviance. Next question. Question 2. What are 2 behaviors that make up obsessive-compulsive disorder, also known as OCD?
Obsession and compulsion.
Correct! That's 1 point for Dr. Cornwall. You were awfully quick to answer that question. Let's see if the next one trips you up. Question 3. What are 5 of the most common obsessions in obsessive-compulsive disorder, also known as OCD?
The need for symmetry, cleanliness, aggressive impulsive, bodily concerns, and sexual concerns.
Oh, I'm sorry, Dr. Cornwall, but you didn't ring the buzzer. However, those were correct, along similar lines. Symmetry. Get it? Question 4. Name 4 commonly associated compulsions of obsessive-compulsive disorder, also known as OCD.
Arranging, ordering, checking, or cleaning. However, other behaviors may come up.
Correct! You're up to 2 whopping points. Question number 5. What other disorder is obsessive-compulsive disorder, also known as OCD, considered to be an alternative form of?
Well, some studies looking at family relations of children with Tourette's syndrome and OCD have speculated that some cases of OCD may be different forms of expressions of TS.
Tourette syndrome, also known as TS, is correct. Add another point. Now for the big question on everyone's mind. Question number 6. Environment or genetic?
Unfortunately, that's one question that has yet to be answered. Many twin studies have looked for a correlation, and there seems to be a slight one for OCD in children. With all the research available, there's evidence for both. And as you should know from Dr. Rosenthal's class, a disorder never chalks up to be from just one cause.
That was a bit wishy-washy, so we'll call it a wash. That leaves you with 3 whole points. Now for the bonus round. These questions are worth 100 points each. What popular online comic did a parody that included obsessive-compulsive disorder, also known as OCD?
I have no clue.
You're missing out. It's XKCD, of course. Well, you still have 1 more shot. Wink, wink. What is Dr. Rosenthal's college basketball team?
University of Kentucky, of course.
Wow, correct! How did you know that?
Doesn't everybody know that?
True. Well, now that you've won 103 points, might as well get down to business. Would you mind telling the viewers today about some cold hard facts about obsessive-compulsive disorder, also known as OCD?
Of course. In childhood, more males than females are afflicted with OCD, but this reverses in adulthood so that it's more prevalent in women. If left untreated, it is a chronic disorder. Even when treated, OCD may come back in a changed form. though the function is the same. The compulsions are a behavioral response to reduce stress caused by the obsessions.
So, how do you cure obsessive compulsive disorder, also known as OCD?
Well, there's no way to cure OCD, but there are a few treatment plans to help put it in remission with the hope that it won't return. From the medical perspective, patients can be treated with SSRIs, which is effective in 60% of the cases. However, there's a high rate of relapse when these drugs are discontinued. A more extreme possibility is psychosurgery. This isn't the best option unless someone's OCD is so extreme no other methods work. Even then, it's only effective about 30% of the time. However, one longitudinal study showed that 61% of the patients had improved, meaning they had fewer symptoms of OCD. The most effective treatment remains to be cognitive behavioral therapy. Some studies show CBD to be up to 84% effective. It uses exposure therapy and response prevention to try and change the behaviors and stop the obsessions and compulsions of patients.
Thank you, Dr. Cornwall. For those of you at home who may not understand some of the terms she just said, here they are. Selective serotonin reuptake inhibitors, also known as SSRIs, are used as a drug treatment for obsessive compulsive disorder, also known as OCD. The therapeutic treatment is called cognitive behavioral therapy, also known as CBT. Well, thank you again, Dr. Cornwall. I'll be seeing you next week. Bye-bye. See ya. Later. Hello again. Hi there once more. Welcome back. Wasn't that fascinating? But now we can focus on an even more fascinating subject, my obsessive compulsive disorder, also known as OCD. As you may have gotten from this episode so far, I have a few behaviors that are considered compulsions. My compulsions stem from a type of social phobia. I worry about what people think of me, so I do certain acts to help me calm down. The first thing you may have noticed, hopefully my editors cut most of that out, is the way I greet people. I always have to greet them 3 times to make sure I do it exactly right. I also fidget when people talk to me. It keeps my mind off saying the wrong thing. It's not too noticeable. When I'm sitting down, my leg starts pulsing up and down, and when I'm standing, I twirl my ring around my finger. A lot of people do this without realizing it. What makes it part of my obsessive compulsive disorder, also known as OCD, is its function to help me calm down in social settings, and the fact that I just can't not do it when someone talks to me. I also can't use acronyms without saying what they mean. Sometimes I even have to repeat an acronym someone else says with its full meaning. I just want people to know what I'm talking about when I use one. Just so you know this is legit, we'll be taking a look at clips from last year's Thanksgiving with my family. I'll point out where my obsessive compulsive disorder, also known as OCD, comes into play. Preparations for Thanksgiving start early at our house. Now here's where my sister comes in and starts asking what I want for Christmas.
I was thinking about a raincoat and some cowboy boots and probably a few more weekends.
Whoa, that was a close call. Let's watch again. There's the questions, and the dishes slip out of my hand, and I start with the ring. Boy, would that have been bad if I'd broken one of the serving platters. Skipping ahead to around 10 a.m., the family starts to show up.
Happy Thanksgiving for today. Hey Beth, how are you doing today? Hey Steve, how are you Steve? Happy Thanksgiving.
Man, that's just rough play there. One right after the other. It's like I couldn't even catch my breath before I had to say hello to the next person walking through the door. Makes you wonder who's calling the shots. Here we go now to the saying of grace. Some people might call this the Hail Mary play.
Dear Lord, we thank
Let's
you
take
for
a look.
family and for being here today, and we thank you for our daughter, Allie. Amen.
Let's see, do we have another angle?
Dear
That
Lord,
was an
we thank you
iffy
for
call.
today, we thank you for our family, and we thank you especially for our daughter, Allie.
Yep, there it is, the leg pulse. Wow, you never realize how much you do something until you get it on camera. Well, that's about all the time we have for today, folks. But tune in next time for obsessive compulsive disorder, also known as OCD, versus getting asked to the prom on the Obsessive Compulsive Zone.